What is sciatica pain? Before we dive into the causes, it's important to understand what sciatica is. Simply put, sciatica refers to any pain that occurs along the course of the sciatic nerve. This large nerve is the longest and widest in the body, and it branches from the lower back. The sciatic nerve then travels through the pelvis and down the leg, supplying various muscles and structures with signals. Therefore, sciatica isn't a condition in itself, but rather a symptom of an underlying problem. What are the top 10 most common causes of sciatica? With over 40 million people in the US alone suffering from sciatica, it's essential to be aware of the most common causes. Here are the top 10. Number 1. Herniated. Disc A herniated disc is a common cause of sciatica. This occurs when a spinal disc ruptures or bulges and presses on the sciatic nerve. Discs provide cushion and support between the vertebrae in your spine. When they bulge or rupture, the soft inner portion can push through the tougher outer layer and press on nearby nerves. This pressure results in sciatica symptoms like pain, numbness, and muscle weakness. Number 2. Spinal stenosis. Spinal stenosis is another frequent cause of sciatica. This condition involves the narrowing of the spinal canal, or the spaces within the vertebrae. As the canal narrows, it places pressure on the spinal cord and the nerve roots. The sciatic nerve, being one of these nerve roots, can become compressed and irritated. This compression results in the typical sciatic pain, which is often worse with walking and relieved by sitting. Spinal stenosis typically affects older adults, and many cases are related to arthritis or degenerative disc disease. Number 3. Piriformis syndrome. The piriformis muscle is a small muscle located deep in the gluteus maximus muscle. It runs from the sacrum to the front of the hip, and it passes directly over the sciatic nerve. When the muscle becomes tight or spasms, it can put pressure on the nerve. This compression results in a type of sciatica that causes burning, tingling, or sharp pain down the leg. Stretching or direct pressure on the piriformis muscle is often the trigger for this pain. And while it's not always easy to identify, it's crucial to consider piriformis syndrome when dealing with sciatica. Number 4. Degenerative disc disease. As we age, our spinal discs can deteriorate, leading to degenerative disc disease. This process can cause the discs to lose their ability to absorb shock and provide cushioning, which can result in pressure on the sciatic nerve. The pressure can lead to inflammation and irritation of the nerve, causing sciatica. Additionally, the deterioration of discs can also cause the bones of the spine to rub against each other, leading to bone spurs that might further compress the sciatic nerve. Number 5. Injury or trauma. Injuries to the back or spine can be a significant cause of sciatica. Accidents, falls, or sudden forceful movements can strain or tear ligaments, tendons, and even discs. These injuries can directly damage the sciatic nerve, leading to immediate and severe sciatica pain. In some cases, injuries can even cause fractures in the spine, which can lead to nerve compression and subsequent sciatica. Prompt medical attention is crucial after such injuries to assess the extent of the damage and receive appropriate treatment. Number 6. Poor posture. Poor posture, especially prolonged slouching, can contribute to sciatica. When you sit or stand in positions that are not aligned with your spine's natural curves, it puts abnormal stress on the discs and joints in your lower back. Over time, this stress can lead to bulging discs or nerve compression, resulting in sciatica. Maintaining good posture and practicing proper body mechanics can help prevent this type of sciatica. However, changing long-term habits can be challenging and require consistent effort. Number 7. Overweight. Excess body weight places added pressure on the spine, particularly in the lower back region. This pressure can be a significant factor in the development of sciatica, especially when it comes to individuals who are severely overweight. The weight strain can cause the discs in the lower back to bulge or rupture, leading to compression of the sciatic nerve. Additionally, carrying excess weight can also contribute to other conditions like spinal stenosis and degenerative disc disease, both of which are common causes of sciatica. Maintaining a healthy weight through diet and exercise is essential for reducing the risk of sciatica and other spinal issues. Number 8. Sedentary lifestyle. A sedentary lifestyle with a lack of physical activity can weaken the muscles that support the spine. These core muscles play a vital role in maintaining the spine's stability and distributing its load. When these muscles are weak, the spine is more vulnerable to injury and strain, making it more susceptible to conditions like disc degeneration and spinal stenosis. These conditions can subsequently lead to sciatica. Regular exercise and maintaining a physically active lifestyle are essential to strengthen the back muscles and reduce the risk of sciatica associated with a sedentary lifestyle. Number 9. Bone spurs. Bone spurs, also known as osteophytes, are bony growths that can develop along the edges of the vertebrae. These growths can occur due to various factors, including arthritis or wear and tear on the spine. Bone spurs in the lower back can extend into the spinal canal or press against the openings where nerve roots exit the spinal cord. When this happens, the sciatic nerve or any of the nerve roots can become pinched. This compression leads to sciatica symptoms such as pain, tingling, and numbness. Bone spurs are commonly associated with spinal stenosis and can make it more difficult to walk or stand for extended periods. Number 10. Diabetes. Diabetes can increase the risk of sciatica due to its potential impact on the nervous system. High blood sugar levels associated with diabetes can damage the walls of small blood vessels, including those that supply blood to the nerves. Over time, this damage can affect the function and structure of the nerves, making them more susceptible to injury and less resilient to compression. For instance, when a herniated disc presses on a sciatic nerve, the damage caused by diabetes can worsen the severity of the compression. As a result, individuals with poorly controlled diabetes may experience more severe sciatica symptoms than those without diabetes. Managing blood sugar levels effectively is crucial for individuals with diabetes to mitigate the risk of diabetic neuropathy and reduce the severity of sciatica symptoms. When to see a doctor. About sciatica, while some cases of sciatica might resolve on their own, it's important to consult a doctor if you experience any of the following. Persistent or worsening pain. Pain that persists for several weeks despite conservative treatment, severe pain that interferes with daily activities, weakness or numbness in the leg that affects balance or walking, redness or swelling around the affected area, fever accompanied by sciatic pain. Seeking timely medical attention can help prevent further complications and ensure appropriate management of sciatica and its underlying causes. Understanding the causes of sciatica is crucial for effective prevention and treatment. By being aware of the common causes and taking steps to address them, you can significantly reduce your risk of developing sciatica and alleviate the discomfort associated with this condition. Remember to maintain good posture, engage in regular exercise, manage your weight, and seek medical advice when necessary. If you found this video helpful, please don't hesitate to share it with others. Your support means a lot to us. Take care and stay active for a healthier life. Do you know anyone who's currently dealing with sciatica pain? Feel free to share your experiences in the comment section below. Your stories might help someone going through the same issue. Thanks for watching and see you next time.